Good morning, everyone, and happy April Fool's Day. Dr. Z here, the King of the Fools, and thank you for joining me this morning. Let's dive right into today's topic, which is no joke, but this is a question I'm starting to get a lot of here recently because it's kind of an emerging thing in dentistry, and so that question is, what are oral probiotics? And so basically the simple answer to that is that oral probiotics are a way to reduce our chance of getting cavities or reduce our chance of getting bone and gum disease, but from a different standpoint, in the sense that we've talked in the past that our mouth contains both good bacteria and bad bacteria, and the bad bacteria are the ones that can cause cavities and cause periodontal disease. And the good bacteria are just kind of there duking it out with the bad bacteria, kind of survival of the fittest. And so essentially what oral probiotics are is just a treatment where you're essentially introducing more good bacteria to your mouth to give them an edge in that fight against the bad bacteria. Kind of the same thing that we have with our gut health. I'm sure many of you have heard of probiotics to help with like digestive issues, that a lot of the bad bacteria that can cause all sorts of stomach issues, stomach flu, all of that gnarly stuff. If you take some probiotics, it adds more good bacteria to your gut, helps kind of balance things out, gets rid of the imbalance of those bad bacteria. Same idea with oral probiotics. The same concept, just for a different part of the body. And so again, just introducing those good bacteria to tip the scales towards good bacteria and edge out some of the bad bacteria that are going to cause various dental problems. So again, kind of another preventive measure that we have in our tool belt, along with fluoride and dental cleanings, and we just talked last week about dental sealants. All of these things are good preventive measures to, again, they're not foolproof, but reduce our chance of having a dental problem when we go in for our visit with our dentist. So yeah, again, kind of a simple topic, but one that's emerging and becoming a more mainstream offering in dentistry. So I hope that makes sense and clears things up. And as always, thank you for joining me this morning, and I hope you'll join me on next week's Tooth Teacher Tuesday.